Hello and welcome to the My Dietitian Journey podcast. My name is Adam, co-host and producer. With me, of course, Felicia Peraza of Peraza Nutrition and My Dietitian Journey. Today we're going to talk about working with patients with mental health conditions.
Yes, so we're going to talk about patients who live with mental health condition. We're specifically going to cover like depression, anxiety, PTSD. So just as a warning, some sensitive topics might come up in this podcast, and there's mental health resources that are provided in the description. Nothing said in this podcast constitutes any kind of diagnosis, and everything is for entertainment purposes only.
So do you want to get into some background on mental health diagnoses?
Yeah, so this is really important to just kind of have like a base understanding of different mental health conditions, especially if you don't have lived experience to best be able to understand your patient. So that's kind of why we want to talk a little bit about kind of I would say the top three that I would typically see that you might also if you're working in outpatient settings.
So top three, number one being depression.
Depression, so also known as major depression, major depressive disorder, clinical depression, but it's a common but very serious disorder that affects the mood, and it can really impact the way an individual feels, how they think, how they handle daily activities like sleeping, eating, or working. And for an individual to be diagnosed with depression, their symptoms must be present for more than 2 weeks.
Next one would be anxiety.
Anxiety, which for individuals who have an anxiety disorder, the anxiety doesn't go away and can get worse over time. So it's not like just the anxiety you might feel before like a presentation, but these symptoms really interfere with an individual's daily activities. So their job performance, their schoolwork, their relationships. And there's different types of anxiety disorders. So everything from generalized anxiety disorder to panic disorder, social anxiety, and then also like phobia-related conditions.
So the important distinction with anxiety is, I guess, that it's not a temporary thing. They just always feel it, and it's not always prefaced by an event or something. Like if you feel anxious prior to a performance, that's not a mental health issue.
Yes.
So the next one would be PTSD.
Yeah, so for PTSD or post-traumatic stress disorder, this is a disorder that develops in some people who have experienced like a shocking, scary, or dangerous event. People can experience a range of reactions after trauma. And with individuals who are diagnosed with PTSD, they might not recover fully from those initial symptoms. And so they continue to experience problems throughout their life.
So can you talk about some of the research that connects mental health and nutrition, how they impact one another?
Yeah, so with mental health conditions, they can absolutely impact nutrition. So being in a negative mood state can lead to decreased concentration, decreased mental endurance, and even slow your thinking, which could obviously pose a pretty big issue if someone is, let's say, trying to develop cooking skills or perform like basic meal preparation. And individuals who have mental health conditions are at a higher risk for physical health problems. And this is greater than those without mental health conditions. So depression, for example, can lead to physical illness by actually weakening or altering the immune response. And then depression can be associated with poor self-care. So this can lead to someone maybe sleeping less, exercising less, having a poor diet, or even engaging in like smoking or alcohol or drug use. And this is at a higher rate than individuals who are not diagnosed with depression.
So how do you see mental health impacting your patients' nutrition?
So the big thing that I see is with depression and anxiety and PTSD in particular. But one thing I will say is just off the bat, I find individuals who are taking like psychiatric medications that can influence how much they eat. So their appetite can either cause a spike in their appetite or actually a decrease. And everything can just overall feel hard when someone is managing a mental health condition. So that's just something to keep in mind when you're setting goals or working with an individual. But depression, for example, in my patients, I see that often leading to like low motivation to exercise, poor appetite. So kind of how I might manage that would be helping them to focus on just regular small meals, snacks, really just things that are easy to also implement. So like smoothies, shakes, or pre-made options could be ways to kind of go about that. PTSD is another big one that I see with the patients that I work with. So for some individuals, I've seen this cause like unintentional weight loss. So high calorie shakes, high calorie meal replacements, high calorie snacks like avocado or nuts or seeds, even like just really quick things to have on hand like trail mix. And it's really just to get enough nutrition in the small amounts that they might be eating. I've also had patients that might struggle with waking up multiple times throughout the night with having like nightmares. And this can really impact obviously their next day. So the energy to cook, the energy to exercise. So obviously you want to make sure that they're working with a healthcare professional because medications could be something to look at, but meal planning and prepping and kind of like freezing things to have on hand, especially when someone's just like super tired the next day. And also looking at like high points of the day where their energy levels are higher. So I have some individuals where, at the beginning of the day, they have the most energy and that's like the time that they want to plan to exercise or prep their foods or things like that. And then also just from a perspective of looking at sleep hygiene, that's not something that's out of scope to talk about. So that might be something else that you might discuss with a patient, like looking at, eating and drinking before bed. Sometimes that can negatively impact, how someone falls asleep or stays asleep. Lighting and curtains, things like that can also impact someone's nighttime routine as well. And then how often they're sleeping through the night. And a big thing that I see also with patients is that, the anxiety around cooking and having food available sometimes could be overwhelming. And so they might be eating very similar foods and like be in a rut with foods, which can be really difficult, especially if they're trying to manage like another condition like diabetes or heart disease. So with those individuals, again, kind of really focusing in on like simple meals, maybe no bake recipes, just things to kind of really help them to decrease the anxiousness that they have around food. Because some clients might turn to food for comfort, especially in stressful times. And just really trying to meet them where they're at is going to be really important.
So it kind of seems like if someone's dealing with a severe mental health issue or some kind of mental illness that impacts their ability to adequately obtain proper nutrition, the best thing to do is just sort of prepare for that in advance.
Yes.
Take as many steps as you could, which is kind of good advice for sort of anyone. Like you'd want anyone to have options for like no bake recipes or have some food prepped and frozen ahead of time, stuff like that. But it adds another layer of importance to that preparation if you're dealing with a mental health issue that may incapacitate you for a day or two or highly impact your capability of making sound decisions or controlling your impulses.
Yeah, absolutely. So the planning aspect is really key. So when they're in like a higher energy state, or if their depression is more managed or whatever it might be, kind of helping to plan for the days when they might have a low episode. So having those like freezer meals on hand, having just like no bake things, like even like fruit cups and peanut butter, like really simple things to have on hand. But it is the planning for, when they get into these specific timeframes where they might not be able to care for themselves in the best way. And sometimes just planning for the right now is one way I like to think about it too, because sometimes it could be overwhelming to be like planning super far in advance for someone. Especially I see this with my patients who live with anxiety, is that sometimes we have to just focus on what is happening right now, what is being impacted right now in terms of their nutrition, what is the priority. So like really prioritizing for some of my patients, like exercise is just not something we need to talk about right now. We really need to focus on getting enough calories throughout the day. And how that looks right now might be different 2 weeks from now. So being able to be flexible with your patients, but also not like overly set a bunch of goals, which can actually be more anxiety provoking too.
So we talked about how mental health can impact nutrition and some studies and things on that. But the way nutrition impacts mental health is sort of a different story, because the way you eat and what you eat can impact your mental health. It's kind of the reverse of what we just talked about. So how can nutrition impact your mental health?
So there's a lot of research on overall diet and how that impacts mental health conditions. So there's a couple of like really key studies. One is called the SUN cohort study, which they basically followed university students for 4 years. And they found that those who adhered to the Mediterranean style of eating had actually a 30% reduced risk of developing depression. There was also a study called the SMILES trial, and this was a 12-week single-blind randomized control trial, and they had also individual sessions with a dietitian. They had 7, and they had what's called a MOD-MED diet, which was basically like a modified Mediterranean diet. So it really emphasized things like fruits, vegetables, whole grains, oily fish, extra virgin olive oil, legumes, raw unsalted nuts, and they had nutrition counseling support, again, from a qualified dietitian. And they found that there were improvements in major depressive disorder and also diet quality, obviously. And then another major one is called the HELFIMED HELFIMED study. And this was a meta-analysis of observational studies that showed that a healthy diet and a Mediterranean diet, which comes up a lot in the research, was associated with a lower risk of depression. So they had higher vegetable consumption. People reported having less stress, more positive emotions, with actually higher fruit consumption as well. And then they also noted that a higher intake of nuts was associated with reduced depression, anxiety, and stress, and also better mental health, self-worth, and then overall quality of life. So a lot of connections there.
Why do you think the Mediterranean diet is featured so heavily in these studies?
So a lot of it is, the Mediterranean diet is actually studied pretty widely for like its benefits on heart health. But the way that the diet is composed, it's really kind of more of a lifestyle. So it's emphasizing things like fruits and vegetables, lean proteins, healthy fats, and things like that. But it actually has been studied pretty widely for cardiovascular disease, and it's coming up a lot in like the mental health space in particular. There's also some studies on like ketogenic diets, and like plant-based diets. The plant aspect, like the fruits and the vegetables, comes up a lot in research. But in overall like diet, like adherence, the Mediterranean diet also seems to be one that people can stick with long term.
Yeah, I feel like that's like a key factor that gets glossed over in terms of diets, is how easy it is to adhere to it, because if you can't stick to it, then there's no value. But if you have the discipline and the will of like a robot or something, sure, yeah, do whatever diet you want. So is there research on specific micronutrients for mental health?
Yeah, so B12 deficiency in particular has been linked with fatigue, depression, poor memory, and actually has been associated with mania and psychosis. Folate, which is a B vitamin, we need that for our brain to function, but that can also, a deficiency can lead to neurological disorders such as depression and also cognitive impairment. There is like more research that's needed specifically with folate and depression. And I will say that there were studies that showed that patients who were taking like anticonvulsant drugs, some of those can actually inhibit folic acid absorption. So they might be at a higher risk for deficiency. Iron is another important one. Some of the research shows that a deficiency in iron can lead to depressed mood, problems with attention. Zinc was another one that comes up in research as well. That relates to growth and function of the brain. And there has been some studies that show that zinc supplementation could be possibly effective in reducing anger and depression. Omega-3 is another one. And again, a lot of these are focused in on deficiencies, but omega-3 deficiency has been linked to an increased risk of several mental health conditions, ADD, attention deficit disorder, dyslexia, dementia, depression, bipolar disorder. And there's been some epidemiological studies that linked low omega-3s with depression in the general population. So a lot of micronutrients, especially with the deficiencies. So that's a lot of where the research is like focused in on an individual having a deficiency and it basically making a lot of these conditions worse, like depression, or increasing the likelihood that someone might struggle with a mental health condition.
Do these studies then supplement that patient or that participant with the micronutrient they're deficient on and then see an improvement?
Yeah, so it wasn't anything that was like a cure-all by any means, but that they improved the symptoms, or that they noted that individuals who had, let's say, depression were more likely to have deficiencies, and then correcting that deficiency improved their symptoms.
So it's more correlative. They noticed patterns.
Yes.
But they didn't necessarily establish a causal link between like B12 and depression or something.
Yeah.
But there was enough correlative data such that it's strongly implying that a deficiency in X increases the likelihood of Y.
Yes.
Okay. And they went into enough confidence with that to sort of rule it as a good enough correlation to suggest that this is real, like this is accurate, like these micronutrients, they do enough in the brain to cause these issues.
Yeah. And what's interesting too is there was a couple of studies on specifically fruits and vegetables, and a lot of it was looking at like the antioxidant content, and there was a increased likelihood of being more happy basically, and higher levels of overall mental health with eating more fruits and vegetables, and a high intake of fruits, vegetables, whole grains, which again is something that's a part of like the Mediterranean diet, was there was an inverse correlation with depression. So the other thing too is when you're looking at like a lot of these kinds of micronutrients and things like that, is sometimes if someone is, let's say, eating more fruits and vegetables, they might overall be doing other things that are improving their mental health, like exercising or drinking more water. And so, these studies are certainly, have a lot of value in them too, but that kind of overall approach to look at, like, it's not to say that if you correct for a B12 deficiency that someone won't have depression or things like that. There's obviously other factors that play a role.
Yeah, pure speculation here, but it seems like there's a common through line between the diets that work, quote unquote, like a plant-based diet, or a lot of people find success with like a paleo diet or the Mediterranean. Mm-hmm. The common through line is that there's an increase in fruits and vegetables. They're highly prioritized in those diets.
Yeah.
So it makes sense.
Yeah, the plant aspect of it. And just like overall, a lot of the research noted that, basically the food that we eat affects our cognition, our memory capacity, and then also our emotions. So then it makes sense as to, what you eat can influence the mood too.
So when you work with your patients specifically, how do you see their nutrition impacting their mental health?
So a lot of the issue that I see with my patients is like poor intake overall. So one, not getting enough calories, which a lot of them say that they have more fatigue, which makes sense. You're not getting enough calories to just kind of go about your day. And then poor intake kind of leading to like negative thought patterns, decreased concentration, things like that. Another really big one that I see with patients is the impact on their nutrition and mental health is that if they're not eating as well, let's say they're eating more like high added sugar foods or, high kind of like overly processed foods, they might not feel good. Like they feel more sluggish, more tired versus if they're eating more like plant foods. And it doesn't mean that they're vegetarian or vegan, but just like a plant emphasis, that they feel better overall. They feel like they have more energy or things like that. So that's a lot of where I see it with my patients, is kind of like having a more balanced diet, that they feel better. And that's like the language they'll use. I just feel better, versus when I'm eating junk food, I don't feel as good. So.
Yeah, I think that's part of the issue with using studies to sort of correlate things like this, is because your body's so multifaceted in the way you eat and the timing and like all this stuff. How hydrated are you? Did you sleep? There's so many different aspects of this that play into where it's hard to say the food specifically is making or breaking your condition. And I'm wondering, in those studies with the micronutrients and mental health, I'm wondering if they took specific note of other aspects of their lifestyle and factored those in?
Some of them did and some of them did not. They did note, some of like the summaries had that they noted that individuals who were eating, like the ones on like fruits and vegetables especially, that they tended to also be drinking more water, being physically active and other things. They're more likely basically to engage in other healthful behaviors. And that's what makes this so hard to study, is that, they're taking like a very small piece, but when you think about your health and your wellness, it's not just the dietary component. It is the sleep aspect. It is the exercise. It is, are you engaging in other behaviors like smoking that's going to impact your mental health, or alcohol consumption and all of that. So a lot of the studies did note that people who were adhering more to these like Mediterranean diets were also like being more like physically active and other healthful behaviors that they had as well.
And just curious if any of these studies for the micronutrient ones, when they talked about increasing that micronutrient, that was sort of the study factor. Did they talk about supplementation via like vitamin pills, or did they talk about the method of delivery for that?
Most of them were like not an over the counter, but like an oral supplement. So not like IV nutrition or anything like that, but they were like single dose supplements. And usually they were in like a pill or capsule form, at least some of the ones that I was seeing.
So they didn't really get into like how it impacted them if they were to increase their food intake for things naturally occurring with that micronutrient.
Yeah. So the ones with like folate in particular, they did emphasize like food sources. And then the ones with like fruits and vegetables, they used like whole fruits and vegetables, not like the specific like antioxidants in like a pill form. The Mediterranean diet was the actual food itself, but more of like the like B12 and zinc. They were more supplementation. And that was again also to correct for a deficiency too. So that was kind of like the most effective.
Yeah, just anytime I hear about anything controlling with micronutrients, I always wonder about if they took a pill or not, because bioavailability plays into it, and then you don't know what they're actually getting out of it.
Yeah, that's a really good point.
What is the RD's role in working with a patient who has a mental health condition?
So as a dietitian, you can really kind of like optimize the nutritional status of your patients. So this can help with enhancing cognitive and emotional functioning for someone who might be living with a mental health condition through their dietary changes. And it doesn't mean that diet is going to replace medications or therapy. It's kind of like an important adjunct to that. And nutrition really is just kind of like a piece of the puzzle. It's not the entire picture. And sometimes eating healthy isn't even the priority. It's like just eating, getting enough calories in. And that sometimes is the focus. And I see that a lot with my patients who might be struggling with like PTSD or depression. Is sometimes it's just, what can you eat when you are having a really rough day? And, you know, as a dietitian, you know, you're an expert in the area of someone's diet, but you can also provide credible information about other areas of wellness. So like information on exercise, like general information, sleep, which both of which can really influence somebody's mental health, emphasizing healthful dietary patterns and how different styles of eating, like we talked about in the research, can translate into relevant information for a patient. And as a dietitian, we are looking at the individual through that nutrition assessment piece. So we're kind of in this unique position to be able to educate a patient on certain nutrients that could be of concern, but also helping them to work with their physician to check maybe their labs for some deficiencies.
So when you're working with patients, what do you do if a patient is undiagnosed and you suspect they have a certain diagnosis?
So the first thing is to ask if they are working with a therapist. And this is something I do pretty often. I also ask if they have any upcoming doctor's appointments. So if I'm like suspecting anything, it's like, when are you meeting with your primary care physician next? You know, if they are working with a therapist, that also kind of gives me a little bit of sense of relief that someone in like the mental health space is monitoring them. And then I might also voice concerns if it's something I'm not diagnosing and you do not want to diagnose because it's out of your scope of practice as a dietitian, but maybe encouraging them to look at information on that subject, bring that to their doctor if they have concerns. Again, if they're not working with a therapist already.
So I guess that kind of brings you to the edge of your scope. How do you deal with staying in scope with this stuff?
So it can be really hard, especially if a patient is very upset in an appointment. And, you know, there is a connection between food and mood. So you will at some point end up discussing mental health in some way or another. But how you respond and kind of like guide the conversation is how you're going to stay in scope. The Academy has a revised scope of practice for dietitians that's specific to mental health and also addictions. And the individual scope of practice really is determined by your education, your training, your credentialing, your experience. But you need to make sure that you are staying within like dietitian realm and not exploring like, well, what made you think in this way, and you don't want to be, again, diagnosing a patient with anything. So if they are coming in and they are, talking about their anxiety or depression, you asking questions of like, when did it first start? And when you're in a depressive episode, was that feel like that is getting out of your scope of practice? But if you say like, how does that impact, the nutrition, your food that you're eating or your day to day in terms of like activity level, that's where you can kind of target it back towards like nutrition versus, the mental health piece of it.
So you said something that makes me think that there is some kind of training or experience that dietitians could pursue that would allow them to expand their scope a bit in terms of mental health. Was that what you were alluding to?
Yeah. So there's, and the thing with like the scope of practice is you can talk about mental health, like mental well-being, but going into like a therapy session about someone's mental health would be the out of scope. There's a couple of dietitians that I've seen that have like an LPC, licensed professional counselor, additional training on that, along with being a registered dietitian. In terms of like other trainings, a lot of it is bringing like awareness and also responding to like crisis situations more so than it is being a therapist. Like if you're going to be in that therapeutic role talking about someone's mental health, then that's where you would need additional training and licensure.
You've had some additional training.
Yes.
And I don't think that you have a specific credential surrounding mental health, but you've done a lot of work with mental health. Specifically as it relates to just mental health outside of the world of nutrition. Would you say that that's impacted your sessions with your patients when it comes to their mental health?
Absolutely. So there's, we'll talk, I think we'll kind of may talk about these a little bit, but there's a training that I did on like it was literally the food and mood connection. And that actually brought a lot of awareness as to how much diet impacts mental health. And that was something that I just kind of dove into the research and felt much more confident in like talking to my patients about, how nutrition can impact their mental health, while also kind of reminding them that this is not like a cure-all or anything like that, that if they're eating better, it doesn't mean that their PTSD or depression is going to go away. And then I also did more training that was kind of geared towards like the crisis aspect. So like mental health first aid is something. And then also question, persuade, respond, QPR training. And again, those are more for like kind of crisis, but that also made me feel more confident that if I'm talking to someone and a situation arises, that I know how to handle that as to the next steps.
I don't know if we want to get into it, but you did have a pretty emotionally charged incident with a particular patient that I can recall. Mm-hmm. Do you want to get into what happens or what you should do if a patient does share something that's very emotionally charged?
Yes. And this is something that has come up, and there were a couple like big instances that like really stick out in my brain with patients where they've had, really serious things happen, and they might even be like borderline in crisis right then and there. So one is making sure that you're staying focused on your patient and their needs. Empathy is going to be really key. Not saying that, I'm so sorry and all of that, but like really listening to what they have to say, like listening actively, but also not trying to fix them. I think that's something that is a natural response. People want to fix things. How can we make this better? And a lot of times people just want to be heard. First of all, validate what they're feeling. And depending on the situation, if you could tie it back into nutrition and in your scope, that's one thing. But if they are in a really rough spot in that moment, it might also be an area for you to kind of bring up working with a therapist, or bringing up that specific topic to their therapist, or maybe contacting their therapist right then and there, which is something that I had done with a patient who was kind of, I would say, borderline in crisis, and just knew at the moment as I was talking to them that we're not having a session about nutrition. This is not the priority right now. Their safety is the priority. And I actually had them call their therapist while we were in the session, and then we basically discontinued the session and they connected with their therapist, but that was what they needed in the moment.
So you had the mental wherewithal to basically transfer their care.
Yes.
From yours to the therapist. and being able to identify when that's necessary is key in terms of working with patients with mental health issues.
Yeah. And I would say like, this is where like those trainings, like I did the mental health first aid. And so it teaches you kind of recognizing warning signs, but also what to do if someone's in crisis versus not in crisis and what that actually means. And that also gave me a lot more confidence of being able to kind of recognize and say to the patient, like, you know, that I was noticing this or that. And with this patient in particular, they were very open for me asking them to like, you know, are you okay with contacting your therapist right now? And how about we do that right now? Because I didn't feel comfortable kind of going with the session. And I knew that as they were talking, they needed to be talking to their therapist, not to me. Because I was like, I don't want to do any harm, you know, in this conversation. But I listened to them. I validated what they were feeling. But then I said, you know, I am concerned. And I knew that they already had a therapist. You know, how would you feel about giving them a call right now? And, you know, that kind of thing. So,
you know, it's interesting because in that situation, you had the training and the knowledge to handle it well in the moment. But had you not have been prepared for that, you would have not been able to handle it nearly as well as you did. And it's mental health first aid is an interesting analogy to physical health first aid because it's a very similar situation where if you're in the moment with a person who needs that first aid and you don't know how to do it, you're potentially not able to help them in a very critical way. Mm-hmm. But if you have the training and never need it, that's far better than needing the training and not having it.
Yeah.
Which in your case, you had the training when you needed it to handle that situation.
Yeah.
Kind of seems like anyone who does this sort of work should have that capability as just a baseline. It's not like you need to become a psychologist or something. You don't need to become a therapist. But having that baseline first aid to help someone in the moment is really important. It's the same for physical first aid. Like if you know CPR and basic first aid for like controlling bleeding and like the very, very basics, it's very similar. So it's interesting that there's a mental health first aid component that's equal. It's like the same thing, basically. Where if you need it in the moment, you have it, boom, you can do it. You're potentially saving someone in a sense.
That's exactly the way that they talk about it too. When I did the training is that, you know, if you think about like regular first aid, you know, you're that first point of contact that an individual has and kind of you're basically helping to kind of in a sense triage, you know, what's going to happen next. But that interaction could be super impactful. So being able to kind of be calm in the situation and then also know what to do. And also taking care of yourself afterwards too. You know, that session for me was probably one of the like most impactful. And I've had situations like that afterwards with patients. And it could be really like kind of throw you off balance a little bit. So being able to kind of really just like take some time for yourself, you know, if you need to like talk about it without like breaking confidentiality, but it can really weigh on you emotionally. And then also I was like second guessing, did I do the right thing and all of that. But, you know, looking back at it, it's like, I did do the right thing. I did the best that I could in that situation. But it can be really tough afterwards.
Yeah, there is a level of self-care after a traumatic event like that that's pretty necessary that you should do. It's funny because it's like the same exact thing for physical health. Like I don't want to get into what I've done or what I do, but like I can relate to that situation to where it's traumatic afterwards when you go through something like that with someone. And you should absolutely prioritize caring for yourself in those moments afterwards. Mm. It's as important as knowing how to do the thing in the moment, having had the training, is making sure that you're okay afterwards if you have something traumatic like that happen.
Yeah.
How do you navigate the conversation when you see a mental health diagnosis on paper?
So when I am working with an individual for the first appointment, I do a review on their medical history because I would say like 99% of the time patients leave things off of their medical history because they're like taking a medication for it or they forget about it because it's managed. And so I confirm health conditions. And then while I'm going through that, I just also confirm, I see on here that you have anxiety. Are you working currently with a therapist? So I talk about it like it is just any other condition, diabetes, heart disease. You know, it's not this like big thing. It is just something else that they're also managing. A lot of times if a patient is not working with a therapist, they might just say, I've had anxiety for a while, or I've been, you know, working on it myself or something like that. And I usually ask them to, you know, if there's anything that they'd like me to know about their mental health condition and how this might impact, you know, their wellness, their nutrition. And usually this conversation is a lot more organic based on their response as to whether or not they're working with a therapist. I will have some patients who just kind of like dive into it and let me know what's going on or how long they've been working with a therapist. And then I have other patients who say like, yep, I'm working with a therapist. I see them weekly or bi-weekly. And then we just kind of move on in the conversation.
What if a patient doesn't want to see a therapist?
So that is absolutely their right. So sometimes I'll provide them with options of where they could seek information or if they were looking to get a therapist. Now obviously health insurance is one route, but there's other like directories like Psychology Today. I also give them other resources like NAMI, the National Alliance on Mental Illness. They have local chapters with support groups for not only those who might be living with a mental health condition, but also families. And they have, everything is free. And then there's also the Substance Abuse and Mental Health Services Administration, which is basically within the U.S. Department of Health and Human Services. And they have they have like a national helpline, but they also have information on like substance abuse, Wildfire Alliance, which has like groups and a peer support group line. So I might give like these kinds of resources because sometimes I'll have patients who say that they don't want to work with a therapist because they can't find one. So they do want to work with someone, but they just can't find one right now, or they can't find one that's a good fit, or they worked with someone previously, or there's no one that takes their insurance or something like that. And I might also maybe provide them with some resources to just kind of give them information on mental health conditions. But really it is their choice. And unless they are really pushing my boundaries as a dietitian and like trying to make it therapy, to say the least, or if I'm sensing that there's a mental health condition that needs to be addressed first, that's where I might be kind of I don't want to say pushy, but more so emphasizing working with a therapist or something like that. I would say most of the patients that I have that don't want to work with a therapist or aren't currently working with one are more stable. And they're not in a situation where I need to kind of discontinue care because I need to make sure that they're working with someone else first.
So what resources should an RD have on hand?
So the biggest one is going to be 988 hotline, which is the 3-digit dialing code that basically routes an individual to the suicide and crisis lifeline. They transitioned away from what was the National Suicide Prevention Lifeline. It's now just 988. That would be, I would say, the biggest resource to make sure that you have on hand. Mental Health America is the other one. So that's where I did my mental health first aid through. And I really suggest this for anyone. It's a skills-based training course that really helps to teach individuals about not just mental health, but also substance use issues. And it teaches you how to help someone who might be experiencing mental health or substance use challenge. And the whole purpose is so you can identify, understand, and then respond to what you might be seeing or experiencing with someone.
Yeah, that mental health first aid thing just sounds like something that's good for literally anybody to do in any capacity. It's like baseline training.
Yeah, absolutely.
Same thing with like, yeah, everyone should do that and then CPR first aid.
I was going to say that's another big one is that people don't think about like CPR and first aid a lot, but that's another, I would say 2 of the first aids. That's what you want to have.
Yeah. Any closing remarks or final tips?
Yeah. So a couple of things. One, you always want to meet the patient where they are. This is going to be really key because a diagnosis of any kind can be super overwhelming. And a lot of times patients might not immediately get treatment because they're feeling pretty overwhelmed, and you might be the first person that they open up to. So I also want you to think about the stigma that might be attached to mental health, the cost of treatment, the accessibility. So if someone's not working with a therapist, there could be a lot of other reasons behind that. Making sure that you're empathetic and that you're listening to an individual. So building a partnership with your patients versus coming at it from like an expert approach, so like telling them what to do or again, trying to fix them. That's not your role at all. And also ask them what would be helpful for them to tell you, and be respectful with any information that you're providing. You don't want to overburden someone, and make sure that you like check in for understanding. Building a referral network is also really key. So connecting with therapists or mental health professionals in your area, having resources on hand. And then also if it makes sense to work with the therapist or the physician, and also encouraging the patient to advocate for themselves, that would also be helpful as well.
Sounds good. All right. Well, with that, we will bid you adieu. Feel free to hit that subscribe button. If you're on YouTube, maybe slap a like down on that one for us. If you wouldn't mind, also leave a comment. If you have any questions or concerns or anything we could fill in for you in terms of gaps, anything we missed. And we will have some links in the description for some mental health resources as well as the studies that were referenced.
Yeah.
If you're listening on iTunes or Spotify, please rate the podcast, as that also helps us for visibility, getting this out to other people who may be interested in these topics. So with that, we're going to wrap it up here at the My Dietitian Journey podcast. Thanks so much for being with us.